Good afternoon, everyone, and thank you for joining today's Insights Condition Information session. My name is Katie Crenshaw with Audacious Inquiry, and our team will be providing technical assistance for today's session. If you need any technical support, type your issue into the Q&A box, and one of our team members will assist you. Please be aware that today's session will be recorded. Closed captioning is also available by clicking on the CC icon at the bottom of the screen. Any questions you may have during the presentation can be placed in the Q&A box and will be addressed either in writing during the presentation or verbally at the end of the presentation by our panelists if time permits. Today's discussion will be led by ASTP's Vaishali Patel, Megan Gabriel, and Papia Paul. To get things started, I'll turn it over to Papia.
Great, thank you, Katie. Great. Next slide, please. Great. So thanks everyone for joining. I'm Papia Paul with ASTP and our Health IT certification program. As always, just a quick disclaimer to start. The materials contained in this presentation are based on the provisions contained in 45 CFR Parts 170 and 171. While every effort has been made to ensure the accuracy of this restatement of those provisions, this presentation is not a legal document. The official program requirements are contained in the relevant laws and regulations. Please note that other federal, state, and local laws may also apply. And this communication is produced and disseminated at U.S. taxpayer expense. Next slide. All right, before I turn things over to our Insights team, we did want to quickly walk through two recent enforcement discretion notices in the certification program that hopefully you're already familiar with by now. These are relevant to upcoming deadlines for both the attestations condition and also the HTI-1 criteria updates. Next slide. So attestations for the April to September 2025 period were due October 31st, but because of the lapse in federal appropriations, the submission system was offline and couldn't be accessed. So to support developers and also address that disruption, we've issued enforcement discretion in place through December 31st, 2025. And what this means is no enforcement action will be taken for missed October submissions as long as they're submitted by year end. So for those who haven't submitted yet, we do encourage you to use this extra time to finalize any of those outstanding submissions. And then looking ahead, the next regular attestation deadline covering the period of October 2025 through March 2026, that'll remain the same. So that submission window will open April 1st as usual and be available through April 30th, 2026. Next slide. We also did want to share a quick update on several HTI-1 revised certification criteria. So these updates were originally due by December 31st of this year, but again, many developers experience delays due to the lapse in appropriations, and several needed resources like the testing tools being offline as a result. So just to help ease that impact, we're also extending the compliance date here. So effectively giving developers through February 28th, 2026 to finish those required updates and get them to customers. This applies to all the certification criteria listed here, and we do hope that this added time provides some extra room as developers in the program continue working toward completing their required HTI-1 updates. Next slide. Thanks again, and as always, you can reach out with any questions that you might have through our Health IT feedback and inquiry portal. That's at healthit.gov/feedback. We'll also have that link at the end of this presentation. And with that, I'll turn over the rest of the session to Vaishali Patel with the Insights team.
Great. Thanks, Papia. Oops. Yep, right here. So thanks, everybody. My name is Vaishali Patel. I'm the Deputy Director of the Technical Strategy and Analysis Division, which is responsible for ASTP's measurement and data analytic activities. And we are here today to provide basically the last minute guidance on the submission for Insights condition. We recently held a session in September, and so some of this material for those who attended the September session will be a bit of a review. But I know there are a number of new developers and others who are joining today. And so thank you for joining. And we do plan to cover much of the material that we went through in September. And we also have some new information to share with you in this session as well. So basically we'll be doing like a recap on, what is Insights, what's the eligibility, what developers must report, and going through some of the definitional issues so that there's a common understanding around those. And then Megan will also go through the new aspects, which is the template for submission and documentation related to that. That'll help you understand the template for submission. And then also just describe the whole life cycle, so to speak, of the Insights condition reporting process. And then we'll go through like next steps, resources, and additional support that's available. Next slide, please. So, the goals for today's session is that at the end of today's session, you should walk away with an understanding of the timelines, the options for submitting your response, what your annual kind of obligations are with regards to Insights reporting, what must be submitted in addition to like the measure and the metrics, documentation, and other materials that need to be submitted, as well as I mentioned, the templates for submission and other alternatives to the templates, as well as supporting documentation, how that submission process will work. And then finally, what our expectations are for reporting, the methodology, and how customers are represented. So hopefully at the end of this, you'll walk away with pretty much all the information you need to be able to determine whether you are eligible and should be reporting for Insights, and if so, what you should be reporting on, how the process works, and the timelines for that process. So, and there's more information also here, just to highlight this website, the Insights Condition website that's at the bottom of this page. It's an excellent resource for you. It'll eventually also have a link to this particular presentation and the recording to this presentation. So I encourage you to bookmark this page if you are involved with the Insights reporting process. And with that, I am going to hand over the reins to Megan Gabriel, who is leading much of the effort related to the day-to-day of Insights Condition. So thanks, Megan.
And thank you, Vishali, for introducing me. I appreciate it. So as she noted, the focus today is really to gain clarity on the Insights condition reporting and certainly eligibility as well. And we want to make sure the timeline, submission expectations, and documentation requirements are clear, especially as we gear up for year one. So as she mentioned, we'll just do a quick recap of the Insights condition reporting and eligibility. So again, Insights comes directly out of the CARES Act, and it's designed to really bring transparency to the performance and use of certified health IT. So it's not just about whether the functionality exists, but how it's actually being used. To understand how certified health IT is performing and how it's used in real world settings to increase transparency and to support improvements. So at its core, Insights is the goal is to help us address gaps in understanding across the health IT marketplace. Next slide, please. Yep. And so Insights, this is kind of the reporting frequency, and this is a kind of a recap of what we talked through in September, but I think it's worth noting. Insights runs on an annual cycle. So You'd collect data over a full calendar year, and then you'd have 6 months to assemble and submit your response. So each July, you'll either submit your product level data, or if reporting doesn't apply, you submit an attestation explaining why. So for year one specifically, data collection runs from January 1st, 2026 through December 31st, 2026. The first half of 2027 is your assembly period, where you would finalize metrics, finalize the methodology, and the customer representation. And then in July 2027, you would either report or attest. So one important thing to note is the overlap. So while you're assembling year one, you're already collecting data for the next year. So that rolling structure is intentional and really designed to make reporting predictable once we have started the cycle. And insights responses are reported at the product level across versions. So if you have multiple versions of the same certified product, those are rolled up into a single response for each metric. So if you have an integrated product, you'd only submit one response per metric. If you rely on another vendor software to meet certification requirements, the reporting responsibility still sits with you as the certified developer, though of course you can work with the vendor to pull those data. Transparency is key. And so once submitted, responses will be publicly available on our ASCP website. And just a note here, responses may also be used for real world testing. And as Papia mentioned and walked through this a bit earlier, at this point, enforcement discretion is in effect for the insights measure reporting. So right now, the only measure ASTP expects developers to report on, if applicable, is the use of FHIR in apps through certified health IT measure. So reporting, again, for this measure begins July 1st, 2027 for year one, and then July 1st, 2028 for year two metrics. Next slide, please. Okay, so as you can see here, most measures across domains such as individuals' access to EHI, clinical information exchange, and public health information exchange are not currently required. So the one exception is the big check mark in green that you can see here in the middle of the page, the use of FHIR in apps through certified health IT measure. So that remains the primary focus for reporting, and all other insights measures remain under enforcement discretion. So developers should concentrate their efforts on preparing for the FHIR in apps measure only. So the key takeaway here for the insight submission response and attestation requirements is that submission is annual and is required. So whether you're reporting data or attesting, each certified product must have a response on file each year. So there's not a scenario where nothing is submitted. If the product is eligible, you submit measure responses. So that means product level aggregated data, a clear description of data sources and methodology, and the percentage of customers represented in the data. And in just a little bit, Vishali will spend some more time describing the methods and how to think about customer percentages. If the product is not eligible, you would submit an attestation instead. So common reasons include not having the certified technology, not meeting the minimum user threshold of 50 hospitals or 500 clinicians, or not having users for that certified functionality. Yep, slide please. So here's a kind of a flow diagram to understand measure reporting requirements. And again, eligibility comes down to a few key questions. So whether the product is certified to G10, whether the user threshold is met, and whether the certified functionality actually has users. So if we look at this flow diagram, if you start looking across all your products to see whether you meet the user threshold, of 50 hospitals or 500 clinicians. If you don't, then you would submit an attestation. If you do meet the threshold, then the next question is whether you have any products certified to the G10 API criteria. If not, you attest. If you do have G10 certified products, then you look at each product and ask whether the G10 functionality has at least one user. If it does, you would submit responses for that product, and if not, then you would attest. So the outcome is always either a response or an attestation for each certified product. Next slide, please. And so the point of this specific measure, the use of FHIR and apps through certified health IT, is to demonstrate real world use, so not just technical capability. These metrics kind of move beyond whether a product can support FHIR to show whether FHIR resources are actually being returned across how many distinct customer deployments and for which user types and resource types. So year one, as you can see on the left-hand side, establishes baseline adoption by counting active deployments, requests, and return FHIR resources. And then year two adds a little bit more maturity by examining use by US Core Implementation Guide version to reflect alignment with evolving standards. And here linked on the bottom are the measure specification sheets. Those are also in our resources at the end. And so there is flexibility, pardon me, in how developers report this measure. So they must use at least the version of the insights measure specifications that were finalized in the HTI 1 final rule, which is version 2. However, you also have the option of reporting under version 4, which went into effect January 2025. And they're very similar, almost the same, but version 4 expands the definition of user type to include a combined category of patient-facing and non-patient-facing endpoints. This is to ensure a more precise reporting as APIs expand in use. But again, this reporting only applies, to the FHIR and apps measure, which is again the sole measure under active enforcement at this time. And we've linked to the fact sheet here, which has some really good resources and information. And so this slide is comparing the reporting requirements for the use of FHIR and apps through certified health IT measure under the version 2 and version 4 of the insights measure specifications. And again, most of the core metrics are consistent across both versions. So for example, reporting the number of certified health IT deployments that return at least one FHIR resource, whether it's overall, patient-facing, or non-patient-facing. And then the same applies to deployments that were active during the reporting period. What's new and different in version 4 is that optional category in red. So developers can now report on deployments that serve both patient-facing and non-patient-facing users together. And just to give a more complete picture for APIs that are supporting multiple audiences, but again, that is not required. So they're aligned on the basics, version 2 and version 4, but version 4 adds this optional flexibility to capture those hybrid use cases. It allows us at ASTP and other stakeholders to really better understand the breadth of API use while still giving developers a choice depending on data availability. Next slide, please. Okay, so let's do a quick walkthrough of the metrics for the measure. The first metric counts the number of distinct certified health IT deployments across customers that successfully returned at least one FHIR resource during the reporting period. Developers will report this count overall and broken out by user type. User types again include the patient-facing apps, non-patient-facing apps, such as those used by providers or payers, and optionally apps that serve both groups. And so by collecting this information, again, ASTP and stakeholders can really get a clearer picture of who is actually using certified APIs and how widely they're deployed. Next slide, please. And then the second year one metric looks at how many certified health IT deployments were actually active during the year. So active would mean the deployment had a functioning FHIR endpoint available at any point in time during the measurement period, which is January 1st, 2026 to December 31st, 2026. And this helps distinguish between deployments that may exist on paper versus those that are operational and available to support access to health information. Like the previous metric, reporting is done both in aggregate and broken out by user type. So taken together with the first metric, this really helps us to understand the presence of FHIR-enabled deployments and their actual use in the field. Next slide, please. This third metric counts API requests that returned at least one FHIR resource reported by FHIR resource type. So user type does not apply here. This kind of shifts from deployments to activity. So it captures the total number of API requests where at least one FHIR resource was returned. And this is reported by the type of FHIR resource. So that means each request must have returned at least one valid resource. And developers will report these data by resource category. So required examples include allergy intolerance, care plan, medication, so on. And then optional categories include resources such as location, practitioner, or practitioner role. Those are optional to be included. And in most cases, it's important to note the percentage of customers represented in the data will be consistent across resources. And well, speaking of customers represented in the data, let me turn it back over to Vishali so she can kind of talk through how to think through the process for choosing a customer definition and calculating the percentages.
Great. Thanks, Megan. Can we advance to the next slide, please? And Megan, there's a question in the chat that I wasn't able to get to. So if you could tackle that while I'm going through this, that'd be great. So choosing a customer definition. Let's go through this. So back in September, we provided guidance through a CCG version 1.3 that where we clarified what we meant by customer and provided additional guidance on the reporting of the percentage of customers represented in the data. In that guidance, we indicated that developers must report the percentage of total customers represented in the data, as well as specifying the specific definition of customer that they were using and how they operationalize that in the documentation. And if there are any reasons for excluding customers, what those reasons are. So, and we also outlined 3 different options for defining customers. So you can select a definition for customers that's provider-based. So based on if you have an inpatient product, for example, you can report out on select that, hospitals are the, your main type of customer. Or if you have an outpatient product and no information on the number of clinicians that are using your product, you can select that as your definition type. So that can be provider-based. A second option is that you can select a deployment-based definition. So based on the unique FHIR-based URLs or API functionality implementations. So if you're tracking that, you can select a deployment-based definition. And finally, the third option is counting customers based on volume of encounters. So the number of encounters during the reporting period. So there are 3 options available, and you would need to select one of those 3 options for, each of the products that you would be reporting on to indicate what, how you're defining your customer. And then the documentation would explain not only how you operationalize that, how are you actually measuring, for example, number of encounters, how do you define encounters, but also any reasons for excluding customers. So for example, if the percentage that you end up with is less than 100%, so less than 100% of your customers are included in the data, what are some of the reasons why it's not 100%? Is it because, some of the functionality might be not enabled that, allows for reporting? Or is it because maybe customers decline to share their data for reporting? So whatever the reason is, one would include it. And then if, again, the CCG that I'm referencing is located at the website, the link that's included in this slide at the bottom. Next slide, please. In terms of actually calculating the percent of customers for each metric, first, for a given product, as Megan mentioned, reporting's at the product level. So for a given product, you would determine the definition of customer that you're going to be using, whether it's provider-based, encounter-based, deployment-based. So you would select that. And you would recommend selecting that, based on what would most accurately reflect your customer base. And then depending on what you select, you would, in the denominator, include all customers. In this case, for the first year of Insights, we're focusing on the fire use measure, and that is aligned with the G10 certification criteria. So you would, in the denominator, include all customers with the product certified to the G10 criteria. And then in the numerator, you would include customers with the product certified to the G10 criteria that are included in the metric. So then you would end up with the percentage of customers that are represented in the data, using the numerator and denominator as I just described. And I think I've mentioned this before, but in terms of, just to reiterate what to report, you would include, for each metric, you're reporting on the percentage of customers included in the data for that particular metric. And then in the documentation, you would indicate what customer definition you're including, how it was operationalized, and then any reasons for excluding the customers, including those listed here on the slide. The functionality was not enabled, system not updated, or the customer declined to share their data. And again, just to reiterate, the percentages must be aggregated at the product level. Next slide, please. I don't know the slide. Okay, perfect. Okay. 5 minutes. Okay. So I'm going to walk through, applying each of those 3 definitions, walk through some examples to help illustrate this a bit more. So as I mentioned, in the denominator, you'd have the total number of customers with the product certified to G10. And then in the numerator, you'd have the total number of customers whose product was certified to G10 who are included in the data. So if you were to apply this, say if you're using, you selected the provider-based definition for reporting. If you have an inpatient product, you might select, you might be reporting on, in the denominator, the total number of hospitals with an inpatient product, with your particular inpatient product, that were certified to G10. And then in the numerator, you would include that same number, except, looking at amongst those who are included in the data. So that's what's in the numerator, the total number of hospitals certified to G10 who are also included in the data. And that would help you calculate your percentage. If you had an outpatient product and you were You knew the number of clinicians who are your customers. You would report in the denominator the total number of clinicians with an outpatient product certified to G10 criteria. And then in the numerator, you would report out on the total number of clinicians with the outpatient product certified to G10 who are also included in the data. So that way you're reporting on overall the percentage of customers, whether that's number of hospitals, number of clinicians that are included in the data for that particular metric. Next slide, please. So with regards to the definition of FHIR-based deployments, so if you selected or planning to select this option, in the denominator, you would have the total number of FHIR deployments associated with your product that is certified to G10. And then in the numerator, you would have the total number of deployments associated with the product certified to G10 that are included in the data for that given metric. So it's aggregated at the product level and it's represented in that particular metric. So as is noted here, the customer percentage should be reported for each metric and aggregated at the product level. Next slide, please. And then finally, the third option is an encounter-based definition. And in terms of operationalizing this, in the denominator for a given product, for a given metric, you would have the total number of encounters within the past year across all your customers for the product that's certified to the G10 criteria. And then in the numerator, you would have the total number of encounters within the past year across all your customers whose product was certified to G10 who are included in the data. So again, it just represents a subset of the denominator, and you would calculate the percentage based on the ratio between the two. Next slide, please. All right, so I'm going to hand it back over to Megan to talk about some of the new updates since September that really focus on documentation and templates for submission and just the whole submission process and cycle of the life cycle of reporting for insights.
Thanks, Vishali. Appreciate it. So just like she noted, since September, we here at ASTP have released some specification aligned documentation, including a quick start guide. We have JSON schema and a CSV template to really support year one reporting. And let's go to the next slide to really talk about, just like Vishali said, the mechanics, I guess, of submission. For year one, reporting or attestation will be due July 2027. So developers will access the Insights submission system by logging through Chapel, the same entry point that we're already familiar with for certification related activities. Once in the system, there are a few ways to submit. So you can enter results directly through a web form, upload a completed CSV template. I'll walk through that in just a second, or upload a JSON file. And those options are meant to give teams flexibility depending on how you manage and prepare the data. We're also planning some additional resources to help developers determine reporting eligibility, and we'll share those with you as soon as they become available. Next slide, please. Okay, so these are the tools that we've put in place to support reporting, and all are based upon the specifications that are linked in the Insights website. The documentation seen here is already linked on our Insights webpage, but we've also provided links here, and we provide links in the resources slide at the end of the presentation. The documentation is meant to be developer facing and is structured to really help guide you through the reporting requirements. So it includes definitions, required data types, and I mentioned has a quick start tab that gives kind of an at-a-glance view of the overall workflow. In addition to the documentation, we've got two templates. The JSON schema enumerates all your required year one data elements in a machine readable format to support structured reporting and validation. And then the CSV template provides the same required elements in a more human readable format to support submission. And all three resources, again, are aligned with the measure specs and are designed to help you prepare your reporting package. Could we go to the next slide, please? Okay, so this kind of flow diagram is meant to detail how everything is connected and how we generated the templates, pardon me. So from the regulation, right, all the way down to what you enter in the templates prior to submission. The measure specification defines what needs to be reported. Measure specs are on our website and linked in this presentation under resources. The documentation is fully aligned with the specs where each metric is translated into specific fields, expected values, requirements, etc. And then from there, those same field names and values and types carry straight into the CSV template and JSON schema. So the point is really just alignment. So if you start with the measure specs and kind of move down, nothing should feel surprising when you get to the template. It's all the same information, just expressed in different formats to support reporting. Next slide, please. Okay, so this documentation file is really the backbone of reporting preparation, and I want to be very clear, this is not something you need to submit. It's just meant to help you understand how the measure, metrics, and data elements all fit together. And Katie, if you don't mind, would you please bring up the document? Thank you. So you'll see there's two tabs here, and this is also linked on our website right now if you'd like to take a look, but I'll just do a quick walkthrough. The first is the Quick Start Summary tab on the left that provides a high-level overview of the reporting workflow. It includes links to the CSV template and JSON schema, and this tab shows those high-level metrics to report, including the required and optional FHIR resources that I talked through earlier. The other tab, if you want to, yeah, thank you. Thank you, Katie. The other tab walks through each reporting element in detail. So if we just look at the top couple of rows, we see the measure metric, field names that align with JSON schema, and the CSV template. The expected value, so a whole number percentage or an integer, measure specification version, whether elements are required or optional, and lastly, some clarifying notes. And Katie, if you don't mind, would you scroll down to line 11, row 11. This shows the detail for the number of requests made to distinct certified health IT deployments across clients that returned at least one FHIR resource by FHIR resource type. Yeah, thank you. And so you'll note here that each FHIR resource is listed as either required or optional. So if we scroll down to row 59, so all these are required, and then it starts with the optional FHIR resource metric. Thank you so much. Yeah, perfect. So you'll note for this metric, we ask for the number of requests that return at least one specific FHIR resource, and then request the percent of customers that returned at least one specific FHIR resource relative to the developer's total customer base certified to G10. So it's important to note, and this is in that kind of quick start summary too, that the percentages of customers represented in the data for this metric most likely would be consistent across the resources. So you could use this alongside the CSV template or JSON schema as a checklist before submission. And again, as I mentioned, this is not something to submit. It's just something to help prepare reporting submissions. Katie, if you don't mind, could we go to the next slide and I'll talk through the JSON schema? Okay, perfect. Thank you so much. So this JSON schema is designed to help provide a structured, machine-readable way to prepare and validate submissions. So it includes field names, formats, and allowable values. The schema gives developers a precise machine-readable definition, right, for all the reporting fields to automate checks, build internal tools, and to ensure that their submission is aligned with the specifications. So this is not meant to replace the documentation, but to support implementation by providing those exact data structures. And the link you can see is on the bottom and in our Insights website as well. And so here's just a screenshot of the CSV template, which is a more human readable option that allows teams to organize and review required data elements before submission. And again, all of these materials are fully aligned with the measure specs, and here is a link to that CSV template as well. Yep. And so let's really bring everything together. So the end-to-end workflow from the data collection through submission to kind of show how these, thank you, these pieces fit across the timeline. So we'll start before the reporting year, so right now, right, by assessing eligibility and confirming what applies to you. And so I know we've said it 1,000 times, but it's worth repeating. Data collection would run January 1st through December 31st. During that time, you'd be mapping data to the specs, documenting your methods, including how the customers are either included or excluded. And then after the reporting period ends on December 31st, the focus shifts to validation and submission. So reporting or attestation happens in July, and then the cycle repeats. So while you're preparing your year one submission in early 2027, you're already collecting data for the next reporting year. So again, year one data collection is January 1st, 2026 through December 31st, 2026, and submissions are due July 2027. And so planning ahead is important. But the main takeaway of this is just meant to show that this is a repeatable annual process rather than just kind of a one-time reporting event. Go to the next slide, please, Katie. Thanks. And I know it's a lot of information, so we'll quickly wrap up with some next steps, some frequently asked questions, and then I'll go through the resources that are available. Next slide, please, Katie. All right. So your next steps would be to confirm your eligibility, decide which specification version you'll use, and then begin collecting data in just a couple weeks as of January 1st, 2026, if reporting applies. Next slide, please. And these are just some common questions we've received, particularly around enforcement, discretion, reporting expectations, and timing. And we've talked through this, but even if no measures apply to you, you still need to submit something. So in that case, you submit an attestation indicating that you don't meet the qualifications for reporting. Second, enforcement discretion does not mean that you should be collecting data and just kind of holding on to it. For measures other than the use of FHIR and apps, you do not need to collect or report data while enforcement discretion is in effect. We've also gotten questions about measure versions. So for the use of FHIR and apps measure, you can use either version 2, which is finalized in HTA1, or version 4. And then finally, to wrap up the facts, for required reporting beginning July 1st, 2027, again, data collection starts January 1st, 2026, and that's kind of lining up with that year one reporting cycle that we walked through earlier. Next slide, please. Yep. And so here's the relevant resources linked throughout this deck on our website, but also just here for your convenience, including the CCG, measure specs, a link to the Health IT inquiry portal, the documentation and templates links as well. Next slide, please. Yep. So for questions, and I know we'll walk through some of the questions today, but the Health IT feedback and inquiry portal is really the best place to go. And so submitting questions early really helps avoid issues closer to submission. Our goal with this presentation and with insights is predictable, transparent reporting. And so Vaishali and Poppy and I just really want to thank you for your time today. And we truly look forward to continuing this work with you as reporting gets underway. And Katie, if you wanted to.
Sure. I know there was one question left in the Q&A. I didn't know if you guys wanted to tackle that before we closed out.
Yeah, Amy McPhee also has a question. It's in the answered bucket, but that's because I don't think that's an insights related question, but anyway, perhaps Poppy, someone could take a look at that. Let's see. Let's take a look at some of these. So here's a question that's insights related. So will those who are not eligible submit their attestation through the chapel site as well? So we didn't really get into the whole platform. We didn't get into the platform that we're planning to use for the insights submission. Don't want to overwhelm you because also it's, not until July 2027, but we are planning to have a process whereby you would be able to go in through the chapel to the platform where you would submit for insight. So you would navigate through chapel to do that. So ideally it's going to remain similar to how you would log in today. In terms of the entry point will be through the chapel. The next question, if we currently have no users as of January 1st, but do later in the year, do we need to report rather than attest? That is a good question. And I think, let me go back and double check on that before we answer. So that's something that maybe what we could do, whoever submitted this, if you could submit it, if you don't mind submitting it through the inquiry portal, we could then answer that. And then that's like publicly available to everybody. We can also plan to send an update on this particular question. I don't want to answer just something off the fly without double checking what we have in the reg text. So, but that's a great question. And then I don't know, Papia, if you wanted to address Amy's question, which is in that, again, it's in that answered column. Or I see that you're typing an answer, sorry.
Yes, yep, sending a response shortly. Thanks.
Okay. Any other questions? If not, you always have the opportunity to ask through the inquiry portal. You can also reach out to me as well. Like, some of this, I'm sure questions are going to come up as this process kicks off, and because the devil is in the details with all this. And I do want to reiterate that this first year in particular is going to be a learning process for both us and you all. So appreciate the collaboration and working together as we implement this program. because we're hoping to really glean some insights, no pun intended, from all the information that you'll be sharing. You're really on the state of the use of fire and, the whole process of implementing a reporting program is new for us. And, so appreciate your patience and look forward to working with all of you.
And thank you, Vaishali, and thank you all for attending today. And thanks to Megan and Poppy as well for contributing to this presentation. ASCP will be posting the slides and recordings on the healthit.gov website in the near future. If you do have any questions, as Vaishali mentioned, please feel free to submit them through the Health IT feedback form, and a member of the team will respond to you. Thank you all, and happy holidays, and enjoy the rest of your day.
Sorry, I just
Oh.
saw one last question.
Oh, okay, we could, before I signed
And
off.
it's another good question. So we will, I don't want to again tackle this one on the fly, but we will, and the question is for those who are not looking at the chat, if we don't have it, if we're not, I'm assuming if you don't have a product certified to G10 at the beginning of 2026, but then later in the year have a product certified to G10, when does Insight start for us? So let me, we'll go back to the reg text, double check before answering this question. And we'll figure out where to post it so that it is available for everybody. And again, good question. Thanks for asking it. And happy holidays, everybody.
Great. Yeah, thanks, Vaishali. We will update the website with these items in the future. Thank you all. Happy holidays and happy end of 2025. Thanks.